Welcome to Beautiful, Confident, and Safe, a podcast by Lewisburg Plastic Surgery featuring Dr. Normington. Hi, I'm Jordan Thomas. In each episode of this show, Dr. Normington and I will sit down for an unscripted conversation about a variety of plastic surgery topics. Our goal, as with everything we do here at Lewisburg Plastic Surgery, is to provide you with the educational resources you need to make the best decision and allow you to feel beautiful, confident, and safe. Let's get started. Hey, Dr. Normington, how are you today?
Hi, Jordan. I'm great.
Good. So Trisha's joining us again today to talk about microneedling. How are you?
Great.
Good. How are you?
Good. So with microneedling, who's a good candidate for that, and what exactly is that treatment?
So microneedling targets stimulating collagen and elastin production. Mm-hmm. So in your early 20s, your body stopped producing new healthy collagen and elastin, and from that point on, your body slowly starts that aging process. So what microneedling does is it helps to injure that collagen elastin so your body creates new healthy collagen and elastin. So that helps with skin laxity, fine lines, enlarged pores. It helps with thickening the skin. Also, any acneic scars, it helps to improve and helps with lines, wrinkles on the neck area as well.
Wow, that's great. Would you say like younger patients are a better candidate, or do you also treat older patients?
Oh, we treat a wide range of patients.
Right.
If they are younger, it's typically due to acne scars. Mm-hmm. However, we treat a lot of patients almost turning 80, and we see wonderful changes in their skin.
That's awesome. And with microneedling, that obviously is something that targets wrinkles. Would you say like patients that are like seeing you for Botox, Dr. Normington, or fillers, is that also a treatment option for them?
Well, so sometimes people come in with fine lines that they're hoping to fill, mm-hmm. and it's difficult to fill those tiny little fine lines. So like commonly people come in with those little lip lines, those little smoker lines, and those are really hard to fill. They're so fine mm-hmm. and tiny that I think people are often better off having microneedling.
Right.
It's a more effective treatment. The other thing, sometimes people come in and instead of having just a couple of lines, it's almost like a global change in the texture of the skin. And it's impossible to treat the entire upper lip, with filler to fill all those lines in those little crevices and things. So when it's a textural thing, I think microneedling is a much better option. Commonly we'll be doing filler and Botox treatments and refer people over to microneedling because they're better candidates for it.
Right. And is it just one treatment that you see effects after, or do you need several?
You need several treatments. Most patients need a series of 6 treatments. They have one once a month for 6 months. And the more treatments they do, the more changes I can make in their skin.
Right. And this sort of treatment does have a little bit more downtime compared to like chemical peel and microdermabrasion, correct?
Right. It does require that day your face looks like you have a moderate sunburn. Although the next morning you can wear makeup and go back to your skincare regimen.
Okay. Can you explain to me exactly what the treatment is?
So the treatment is a pen device that we use, and on the end of the pen there's a cartridge with 14 stainless steel micro needles on it.
Right.
And essentially what we do is we get your face and neck numb. And after you are numb, we start the treatment. We use a glide serum that helps to stimulate collagen, and we just put thousands and thousands of microchannels into the skin to injure that collagen and elastin. During the treatment, you do get overall pinpoint bleeding in the skin, mm-hmm. But then that is removed, and after treatment, your skin looks like you have a moderate sunburn.
Right. And your skin's more sensitive at that time. So it's important for patients to use the right products after, right?
Right. And we put them on those products and give them a regimen as to what to use at home for the next few days after the treatment.
Right.
Trisha, discuss how a doctor's microneedling system is going to be different than the microneedling system they can buy at CVS or QVC. Explain how they're different.
So typically the ones that you can buy over the counter, they're more for product absorption. When you manually apply your skincare products, only 5% gets delivered into the skin, and those rollers are used to increase that product absorption to 80% in the skin. So what we do here with our device is we're actually getting down to the papillary dermis of the skin and reaching the depth where we get the overall pinpoint bleeding to make those changes.
It's a deeper treatment. Right.
Yeah. Well, great. I think that's all really great information. Thank you, guys.
Thank you.
Thank you.
That's a wrap on this episode of the Beautiful, Confident, and Safe podcast, brought to you by Lewisburg Plastic Surgery and Dr. Normington. Please be sure to subscribe to our show so that you never miss an episode. And for more information on Lewisburg Plastic Surgery, please visit us online at lewisburgplastic.com or find us on Facebook at Lewisburg Plastic Surgery and Dermatology or on Instagram at Lewisburg Plastic. We'll see you next time.